Okay, my name is Winfred Kivinya Jackson. I am the sub-county MOH for Masinga. I coordinate healthcare services within the Masinga sub-county. Actually, when it comes to the community scorecard, HERAF has been really very helpful in the facilities that I'm heading and that I'm working with. In Ekalakala, in Kangonde, and in Kifa, most importantly, I was involved in the community scorecard there. And we were able to get a platform whereby we are trying to address our issues in health and issues whereby we are not getting adequate feedback from the community and back to the community. And that has enhanced the kind of understanding that the community has when it comes to healthcare services, and also empowerment of the community also to know that they have rights and there are specific approaches to these rights. And that has enhanced the collaboration between the community and what they need from us. And also we have managed to also ensure that the healthcare delivery services are up to the required standards by the community. Okay, you've already done well. We are to talk about doing well. And maybe I do not know the limitation of your scope or what you can do for us, because we really have so much that we would require or we would want to ask HERAF to support us in. And I know that HERAF has been very instrumental, even the strengthening of the facility committees, health facility management committees. And every other time we usually have changes in these facilities, and we have facility health committees expiring and other community committees coming on board of the facilities now to start running the facility. The earlier committees were sensitized. These other committees are not very well sensitized when it comes to issues to do with the scores, what the community expects. And some of these committees are very instrumental and they are new. Now, if the old ones expire, we have members of the committees that are not sensitized. Number two, implementation of the score. We have already identified what are the key issues, and we are not yet following up to ensure that we push our leaders, community leaders, to give us as a community what we need. I'm speaking on behalf of the entire community. Now, if we can have forums whereby we can maybe discuss issues with our leaders and to question them about what they can do for us. I know that is still the community scorecard, but then we need more, because we have not been able to have forums with our stakeholders and our elected members, especially the politicians and the influential people in the community that can bring major changes and can help us to make decisions where it matters in the county government, so that the community gets what they feel like is priorities to them. Yeah.
I'm Jemima Mudhoni. I am a project officer at Health Rights Advocacy Forum. Health Rights Advocacy Forum is a national NGO registered with the NGO Coordination Board since the year 2007. HERAF works in a number of counties. One of those counties is Machakos County. We also work in Nyeri County. We've worked in Isiolo, Kilifi, and Kwale counties. We are implementing a project to strengthen public responsiveness in Machakos County. This project looked at promoting constitutionalism and the rule of law, participatory processes in terms of inclusivity in decision making, planning, budgeting, implementation, and oversight. We're also looking at participatory monitoring of public expenditure and using the community scorecard to monitor health service delivery. Across both sub-counties, we've seen a great deal of responsiveness of the county government in provision of health commodities. Initially, there was massive stockouts of drugs and commodities, and these would take 6 to 8 months to be replenished. So ideally, it would look like supply to a quarter is once a year, or if they are lucky, twice a year. So what we are realizing is that now supply has significantly improved, not only in quantity, but also in frequency of supplies. So you are seeing facilities receiving commodities every 2 to 3 months. And that's a great and commendable commitment by the current administration. In Itundwimuni, that is in Ekalakala ward, the biggest challenge this facility has had is water. So the advocacy was around having access to water storage tanks. And again, then having water piped into the facility from the community borehole. So what we've been able to see so far is that the county has been able to provide 2-3 water tanks of an approximate 10,000 liters each. And these have already been mounted. So the process of connecting piping from the borehole to the facility, that is an ongoing concern. So the other bit is increased uptake of citizens in terms of public participation. Initially, there is a fatigue that comes with, we always called to a public participation forum, we give our proposals, nobody tells us whether they were included and how, and we are not seeing any change on the ground. So over time, citizens get fatigued. But through continuous civic education, we've seen increased uptake of public participation spaces and demand for feedback and accountability. Again, in terms of beyond health, we've seen citizens who are capacity strengthened. So going forward, we are currently rolling out the participatory monitoring of health budget expenditure. We've been able to conduct a desktop analysis to see what is available. We've also been able to conduct primary healthcare data collection, where we talk to community members, healthcare workers in target facilities, and now we are engaging the sub-county teams just to provide feedback and validate data collected, and also to be able to collect data at that level.
Majina naitwa Peter Mumwakio kutoka eneo ya Kivaa Ward, na lipresenti sana sana vikundi za walemavu PWDs. Tumekuwa na hii shirika ya HERAF na imetufunza mambo mingi, especially katika vikundi za walemavu. We are enlightened. We know our rights through this organization. Pia katika civic education, their staffs normally uses to visit our groups, na wanatufundisha mambo mengi kuhusu civic education. Tukiangalia wakati hii shirika hatukuwa naye na wakati tulianzana naye, kuna a big change. People are now enlightened. Ukienda upande wa hospitali, we have been used to see some writings kama service charter, na hatukuwa tunaelewa what is service charter. Lakini sasa through this organization tumesoma na tukaelezwa, na mambo sasa imekuwa mazuri. Tukienda hospitali, utaratibu unafuatwa, ile muda inafaa ndio inachukuliwa mtu kupata matibabu. Zamani tulikuwa tu watu hawaelewi haki zao, lakini wakati tulijua haki zetu tumefuatilia na mambo imekuwa mazuri. Kwa hivyo nikimalizia, ni shukrani kuu kwa this organization, Uraia, Ndaninda na HERAF zikikusanyika pamoja zimelete mwangaza kwa kijiji chetu, na tunaona tutaenda mbali. Na this coming together with our nurses, hata wengine wanakuwa wangekuwa wanaficha magonjwa mengine, mtu anakuwa free kuelezea daktari na anasaidika. Zamani hiyo ingekuwa, lakini for now we are seeing things in a positive manner.
Penina Mwaniki Nyingi, natoka Itondo Imoni. Nimekuja kama community member. Kwanza nashukuru Mungu mwenye amewafanya mshikane na hiyo shirika ya HERAF, juu inasaidia sana. Mimi kama mama, vile HERAF ilikuja Itondo Imoni tangu 2020, tumeona mabadiliko mengi sana. Sasa wa mama wamesoma, wamejua mambo ya familia na jinsi wanafaa kutunza familia zao. Haya, kulingana na sasa kimimi sasa chenye nimesoma kwa HERAF, ni shirika ambao ni mzuri sana. Sasa kulingana na article 1 imetupea hukumu wa kuulizia mambo vile unapata mambo yamefanyika, na hapo zamani sasa hatukuwa tunajua kumeendelea aje, unapata tu project imeanzia. Lakini saa hii kulingana na tulisoma HERAF, tumejua kwamba tunafaa kuhusishwa na kujumuika tuulizie. Kama kwa mfano sasa kuna project inaanzia, tunaweza kuwa na project kwa kijiji ama hapa tu kwa soko ama kwa hospitali, alafu tuuliziwe unataka tuwajengee choo ama ni lampu ama ni nini. Hiyo hapo zamani haikuwa, ilikuwa tunapata imetengenezwa na hakuna maswali. Lakini for now tumesoma sana kuhusu HERAF, wakatuambia hiyo ni jukumu letu na wakatupea hiyo hukumu ya kuulizia mambo.
I'm Kennedy Mange, I'm a clinical officer working at Kalakala Health Center, Masinga Sub-County. I'm also the facility in charge. HERAF came to our facility 2 months ago. They started training our communities about projects which have been implemented by the county, especially the maternity block as a community hospital. Since HERAF came in, we have seen a lot of benefits, especially our communities are now aware, especially the importance of public participation. They are aware of projects being implemented within the facility, and they are able to assess their progress and their usefulness to the community. To me, again, the HERAF has helped the facility again to look at the gaps within the facility on infrastructure, on service delivery, and what we can do to improve our services to the community we serve. On what I feel should be done more by HERAF, they are doing assessments and public tracking. But again, we hope after they do what they are doing currently, they can, if they can help in resource mobilization to complete some of our projects, because some of those projects have been stored for many years, like the maternity theater. It was done since 2013, 2014, and is currently not functional. So the facility is a busy facility, especially our maternity unit. So mothers who have issues and complications will have to be referred to MATU. So if the project is completed, our mothers will have an area whereby they can get their complications sorted, especially operations, so that we save their babies and their mother's life.
My name is Daniel Motonye. I come from Masinga Sub-County, that is in Machakos County, from Masinga Central Ward. Talking of HERAF, it has changed actually the community. More so, me being a youth leader, it has helped us so much, because we used to find a way on how we can convey messages. That is, how we can lobby, how we can now let our voice be heard to leaders, but it was very hard. But through HERAF, now we can see we are trying to change and push some things, and they are working. So I can say HERAF is very good. Actually, it has helped us even on how to write memos, on how to present our grievances, like on how to monitor the development of county and so on. Like, you see, if you go to some if you go to facilities, you find we have so many things which are happening there in the facility, but you don't know. Actually, we used to like to kusema, we can just come here, we get rich, and then we go. Let's to know that we have so many things to look at there and to monitor on how they are working. And actually, I can say, we did know that we have a right for the administration, for the services. We used to just to come there, you get medicine, then you go home. But now, from the HERAF, I can say we know we have a right to demand for the right service, to know the projects of the facility, and even for the development of the county. Yeah.